All right, so looks like we have a big crowd, so I'm just gonna get started. Good morning, everyone, and welcome to the 7th Annual Canadian Global Health Students and Young Professionals Summit. My name is Zeba, and I joined the GHSYPS 2020 Planning Committee as Partnerships Co-Lead. I'm joining today from the traditional unceded territories of the Mi'kmaq peoples, which is also known as Newfoundland. So we're going to go over a couple of quick housekeeping items, and then we're going to get started with the session today. So we ask that all attendees remain on mute unless you're speaking. Please note that this session will be recorded and made available on our website at GHSYPS.ca following the summit. Just a friendly reminder that anything you share in the chat can be viewed by all the attendees. So please be respectful of our shared space. For those tuning in live, closed captioning is available in English. And if you want to access this feature, click on closed caption button on the Zoom panel, usually at the bottom of the screen. And in the interest of fostering an inclusive and collaborative space, we have developed a code of conduct, and the document is fully accessible in the chat. So without any further delay, I would like to introduce our speaker, Yipeng Ge, who is a resident physician in public health and preventative medicine, which includes family medicine in Ottawa. He's Canada's official delegate to the World Health Assembly and the Pan American Health Organization Directing Council. So I'm going to pass off my invisible mic to Yipeng, so you can get started whenever you're ready.
Thank you so much for the wonderful introductions, and it was really great to hear how the students and young professionals group has adapted to a virtual format and has incorporated all these really important pieces around accessibility and making this space really safe for everyone. So thank you for that. From my lens as a youth delegate to the 73rd World Health Assembly and the Pan American Health Organization Directing Council, I hope to provide hopefully some useful reflections for you all, and then also I'm interested in picking your brains a little bit about some of the questions that I have on my mind in terms of how best to frame the youth positioning from a Canadian youth lens in advance of the resumed 73rd World Health Assembly taking place in November. So I'm going to move to a territorial acknowledgement. I want to acknowledge that I learn, play, and work on the traditional unceded and surrendered territory of the Algonquin people. As was mentioned earlier, I think it's important to reflect upon our relationship to the land and to the traditional stewards of the land, and recognize for usually most of us, we are guests of the land, as are all of us, in terms of how we have to have a healthy relationship to the land and the peoples that we are neighbors to. These are some quick disclosures, some other roles that I currently have, and I'll try my best in recognizing that I'll be speaking from the role of the youth delegate to the World Health Assembly, but some of these other roles have certainly framed my experiences and how I approach some of this leadership work. I want to quickly acknowledge a whole array of people that have, in a non-exhaustive list of people that have contributed to my perspectives and contributed to the content that I put into this presentation for you. And some of these slides are adapted from a slide deck that I prepared for the Office of International Affairs, which is part of the health portfolio within the Public Health Agency of Canada. So that's the direct team that I've been working with And I want to acknowledge one of your planning team members on GHSYPS, William Wang, who is also part of that team that I've been working quite closely with in this role. So I want to acknowledge the past Canadian Youth Delegates to the World Health Assembly for giving their time and guidance as I took on this mandate this past year, as well as all the Canadian youth that have been engaged in my consultations, engagement, strategy, like process to some extent, as well as other youth leaders and delegates from around the world. And some special thank you to others that have played a key role in both me taking on this role, as well as framing some important things to consider moving forward. Additional acknowledgements for many groups and organizations that also contribute their time and energy to either promoting this opportunity, which will also come up in the coming months as we seek to nominate a youth delegate for next year. And once again, the Office of International Affairs for the Health Portfolio that has contributed so much of their time and giving me the space to learn about their work. So these are some questions for reflection that I would urge you to, if you have your phone nearby, or if you have like a screen capture function, to take a picture of these questions. And if you have any immediate thoughts, please put them into the chat because I'd love to read them afterwards. And I know that there's also the private Facebook group for GHSYPS conference. So I'd love to connect with you around some of these questions there as well. So the first question is, how have you as a youth, student, or young professional been impacted by the COVID-19 pandemic? And from your perspective, what do you think is the role of youth in the COVID-19 response at the level of the WHO? How has the COVID-19 pandemic affected your vision of the future in terms of health equity and climate justice? And do you view planetary health as a priority for pandemic recovery, and why or why not? And how can I, as a current youth delegate, bridge the gap between youth and your understanding of the role of youth perspectives at the WHO? So similarly to these questions, I know that the space and time that we have together today right now is quite limited. I'd love to read some of your comments if you have reflections on these questions immediately in the chat, but also I put together a survey for framing some of these questions as well. So if you have a chance to also take a screenshot or a picture of this slide, I would greatly appreciate your involvement in either that survey to have your voice heard as I synthesize the youth perspective in advance of the resumed 73rd WHA in November. As well as I would like to invite you to these youth consultation roundtable sessions that are taking place very, very soon, one at the end of today and one tomorrow. And you'll have my contact information by the end of the slides for this presentation, and I can provide you the information for those roundtable sessions. So before I get into some of my reflections, I want to provide a bit of perspective in terms of who I am and where am I speaking from, and the journey that I have taken, and hopefully that will give some important context to maybe the approach that I take to global health work and global health student leadership or young professional leadership. So this is a picture that I took of my dad's hometown in rural China. He grew up there in a cycle of poverty where it was very hard to break out of a community that only farmed, and they still continue to farm garlic. And through education, through opportunities that opened up through purely education alone, he was able to break through that cycle and bring some of his younger siblings. He's has a group of siblings of 5 siblings, and breaking out of that poverty cycle was, I think, something that has always been on my mind, and something that was formulated as part of my childhood experience growing up in Canada, as he moved the family for the benefit of me and my younger brother to grow up in a community, to grow up in a space and time where there were more opportunities for us. And so I was kind of taught about this pretty early on in my life, and having gone back to his hometown, my hometown, where my roots lie, in terms of that cultural piece, in terms of the family lineage piece. I think it's always something been on my mind in terms of how do I reconcile these different identities, knowing that I also have cousins, knowing that I have uncles that still live in these environments, and how do we move forward from recognizing both privileges unearned, as well as disadvantages that still exist in terms of each of our own intersectoral identities. I was born in Wuhan, China, and this is a picture that I took from the balcony of my grandmother's home. She unfortunately passed away from lung cancer 2 years ago, and I was kind of in the midst of my medical school training at that time. And before that, I had been going back to Wuhan specifically to spend time with her, because she was honestly one of the closest friends that I could confine to, have experiences with. And it was quite difficult for me to go through that experience in medical school, but I was very well supported from both my colleagues and my support networks here at the medical school, and now reflecting also too on some of the rhetoric that has been spread around the possible or the origins of the COVID-19 pandemic in terms of the SARS-CoV-2 virus. In terms of my introduction to global health, some of you might recognize some of these pictures in terms of where they were taken. They're from the McMaster University's campus. And this middle slide is from my student home in terms of we were preparing for the first Indigenous Health Conference that we were wanting to share with the student body at McMaster University. So during my undergraduate years, myself and a few other undergrad students who I hold quite close to my heart in terms of them teaching me so much around what global health is, and in terms of from a health equity approach. I found this nice description that I think captures what I understand global health to be, recognizing it's such an interdisciplinary and complex field that has lots of different definitions tied to it, and sometimes overlap with international health. So global health is the context of populations in the global context. It has been defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. So I credit much of my formulation in terms of how I understand health equity, how I understand social determinants of health, including broader ones such as colonization and assimilation, with regards to ongoing colonialist policies and practices that have a huge impact on people's health, as we see with continued examples of racism in healthcare. And these are things that are very pervasive in the Canadian context, and as well as in a global context. So much of my learning I credit to a lot of Indigenous leaders, scholars, clinicians, historians in Hamilton and Six Nations, where I kind of grew a lot professionally and personally around what to do about some of these things. A book I've been reading recently is from Samir Sahin Hussein, who's an emergency pediatric emergency physician in Montreal. And he says, and he writes, when a state of vulnerability is created by the way society is structured and functions, the term vulnerable is a euphemism that erases the process of marginalization, inequalities in healthcare, follow the fault lines of societal injustices. So I think this really hits at the core of how I understand inequalities and inequities, when we have to frame it from, these complex systems that were never made for the success of certain populations and peoples. Some of you might be aware of this quite famous quote from Dr. Rudolf Virchow, medicine is a social science and politics is nothing but medicine at a larger scale. I think from early on in my medical school journey and career, I learned that these pieces of providing care, medical care for individual patients has some of the most systemic ties to how the system is built in terms of from political decisions and then onwards. One thing that you'll see here from Lori Garrett, who's a journalist who's been covering a lot of COVID-19 pieces, and these science and medical journals have taken editorial stances on the re-election of a certain president a bit south of us. And this has never happened before in terms of the crossover from scientific knowledge or evidence-based science to directly commenting on political structures. But I think that is exactly what is happening now because of the necessary ties for political leadership and political will to the success of health of communities. And I wanted to acknowledge everyone taking their time out of your busy lives and schedules to be able to learn here with me and from one another, because without a doubt, there is power and privilege to being a student and being a learner. I reflect on my time in undergrad, I reflect on my time in medical school, and now as a resident physician who is still in my formal learning years, and I certainly will be learning for the rest of my career and even beyond that. But I think there's so much power to entering a space and asking to learn and having that hat on of being a learner. And I hope that you recognize that and using that that piece of privilege to be able to better the world around you. In terms of that piece, I kind of similarly from some of the things that I just commented on, I think health advocacy became a huge piece in terms of my own medical school career and something that I knew that I needed to be a part of. I think recognizing some of the things that I was learning about, the things that I was experiencing, the past things that I knew about the inequities that existed. So I wanted to use pieces of my identity that have a significant amount of privilege in terms of being a medical learner, in terms of being a student leader, to leverage those pieces to have conversations about moving those things forward. So some of these conversations took place only a couple of years ago in terms of advancing some of the things around health, human resource planning, Indigenous mental wellness, the opioid crisis, and among a few other pieces. This middle picture here with Dr. and Minister Carolyn Bennett was taken quite late on a particular evening. And I snapped this picture after that meeting, and it was, I forget the exact time, but it must have been like 10 or 11 p.m. when the government was doing back-to-back votes, and Minister Carolyn Bennett still took the meeting with me, and we did it in the lobby of the government, and she kind of stepped in and out in between votes just so we could have that conversation about advancing health human resource planning across Canada. I put this piece in here. It's a really good perspective piece from a then medical student who's a resident physician now. He comments on, as medical students, we are educated about the social determinants of health and increasingly warned about burnout, yet little is made of how the former may contribute to the latter. For example, how clinicians may feel worn down by the poverty and oppression of their patients face. They may feel powerless when they cannot offer more than, say, a form letter to a landlord explaining that turning off a patient's heat would be deleterious to their health, and may feel demoralized when they realize that their instruction, do not take this medication on an empty stomach, translates into patients taking their medications only sporadically because they don't have enough to eat. If medical schools and residency programs are serious about burnout, then they have to teach us about collective action, teach us to ask, what can we do to fight burnout? And we should never worry alone about the social determinants of health that patients face. To fight burnout, organize. And I think this reflection, when I came across it, rang so true in terms of how I saw some of the kind of things that wore on me in terms of knowing about inequities and sometimes feeling paralyzed for action. I think it was around 2 years ago, I was on a core surgery rotation and felt quite worn out from the day ins and day outs of a tough clinical rotation. And I reached out to Leo and we had a conversation about what he was experiencing as a medical student and really soon going into residency in the States, and comparing some of the reflections that I had as a Canadian medical student then, and thinking about similarities and differences. But I think a big piece was reaching out, having those conversations, and building these like coalitions for the willing, or coalitions to organize, because we have to find those other people that want to move this work forward, because sometimes knowing about some of these systemic inequalities and not doing something about them can be, once again, paralyzing and possibly contribute to burnout, as he argues here in this perspective piece. I want to say that these pieces that I want to share come from my perspectives and alone. And I mentioned, and I realize I'm kind of saying medical school a lot, medical student a lot, and these are from my experiences, from what I know. But I realize that you all have very different backgrounds and trainings, and I think that's really important to be able to have a really great conversation around public health, around global health, especially around diplomacy and governance. So I think I do want to share that this is where I'm coming from in terms of a clinical medicine training background. I've worked a little bit at the local public health level, and that's where I'll be training for many years now, as well as I've had a taste of federal and international public health over these past couple of months as well. So I think this is my last slide before jumping into the actual meat of the content. So I want to share that I had an opportunity before my 4 years of medical school. So around 4.5 years ago, I interned at the World Health Organization to learn more about what this organization really does, and if it does have an impact on people on a day-to-day basis, does the work trickle down, and what the organization does to kind of convene people. And I met a really great mentor there, Dr. Douglas Betcher, who advocated for me to continue my growth in attending the 9th Global Conference on Health Promotion that took place later on that year in 2016. I think we need to find people that will mentor, that will help grow us and challenge us. And I think earlier I did see Dr. Donald Sutherland, who's I think in the audience. He was the one that put me in contact with, the person that put me in contact with Dr. Douglas Betcher, pictured here on the right here, who was a Dr. Paul Gully. And I had came across a piece that he had spoken to the Globe and Mail about most recently, that was published a couple of days ago, around some of the systemic issues that have impacted the functioning of the Public Health Agency of Canada. So it's really interesting how small of a field public health and global health really are. So I had the opportunity, as I mentioned, to be the youth delegate to the Virtual World Health Assembly, the 73rd iteration, and first time in its history of being virtual. As a Canadian delegation, we had thought about how do we do this, and as you see here, the physical distancing measures were put in place at that point in time, but we hadn't crossed over to universal non-medical use of masking in workplaces, in closed spaces. So it's so interesting to see how things have shifted in such a short amount of time, as you all know. These are some pictures from just back in May. And I was able to provide some live updates, and to provide some context, the World Health Assembly is the governing body for the World Health Organization to set its highest agendas, as well as the organizational pieces around governance and finances for a multilateral organization that takes its orders from, I think, 194 member states, Canada being one of them. Some of the highlights that I want to kind of point out to you was the intervention delivered by Canada by Canada's Minister of Health, Patty Rideau, committed to collaboration on research and vaccine development, supporting vulnerable populations, mental wellness, and reviewing the global pandemic response. I think something that was notable was not a lot of member states, not a lot of other countries around the world at that point, and maybe even now, have really pointed out those impacts to mental wellness, those impacts beyond the immediate impacts of an emergency response on health and community well-being. And I want to speak also quickly on the 58th Pan American Health Organization Directing Council, which I had the opportunity to attend just a couple of weeks ago with the Canadian delegation here once again in a very virtual format. And you might recognize one of the people in the picture, not myself, but William Wang, again, part of the GHSYPS team. So I was mentioning to Lauren before we started this discussion that it was really cool to see someone such as Will be in both a young professional role, but having a huge influence on the policy setting agenda for the Canadian delegation, and being a witness to his work in real time. Some of the highlights that I wanted to point out from this particular meeting, I really appreciated some of the remarks from the high-level presentations, this one being the Prime Minister of Barbados, Honorable Miss Mia Mottley. She commented on the hurricane season as being the heart attacks of the climate crisis. I think that kind of hit me in terms of not only what are we doing for COVID-19 as a pandemic, as a global pandemic response overall, but what can we learn from these pieces? These we've heard all these words that have probably been used excessively, like unprecedented, extraordinary, exceptional. I don't think there's anything to describe what is happening in 2020 to each one of us in a meaningful way anymore, because it's something that will stick out for many years to come, I hope, right? Because people's memories can be thin and we're also easy to forget. So how do we learn from these pieces that are happening right now, and how do we leverage and use this opportunity and find those silver linings to think about, okay, there's a lot of collaboration happening right now. There's a lot of good things happening to advance health and well-being, and prioritizing that above all, because here's another quote from the director for the Pan American Health Organization, Dr. Carissa Etienne. There can be no competition between health and economy. A healthy nation is a wealthy nation. So now more than ever, we recognize beyond just the field of public health and global health and medicine, we recognize that health and well-being must be at the top of the agenda. So how do we keep it at the top of the agenda? How do we recognize that moving forward and use some of these lessons so that we're able to build the structures that we know will have the outcomes that we want? And once again, there was a unique opportunity for me to kind of be a witness to active negotiations as one of the interventions around the COVID-19 pandemic response in the Americas region was put to an informal negotiations process, and being a witness to that, I think was really interesting to see a snapshot of in real time, how does global health diplomacy and international relations work happen, and all the changes that are also due to a virtual setting, which lots of people are also not very familiar with, and the challenges with that. One comment here, it's a slide that I haven't updated, but this is the youth consultation process leading up to the 73rd World Health Assembly back in May. And lots of other conversations have happened in advance of the Pan American Health Organization Directing Council. And I, once again, look forward to seeing some of the comments around the questions that I mentioned earlier in advance of the 73rd resume 73rd WHA in November. So these are some of the guiding questions that I think all the way back to maybe March, April, that were posed to people such as yourself in terms of how the COVID-19 pandemic impacts have affected you locally, the differences in terms of comparing some of the responses around the world, and using this opportunity for change, recognizing that there are ongoing crises such as the climate crises, such as the opioid epidemic crises, homelessness crises. How do we tackle these things from both the perspective of being prepared and preventing ongoing crises, but also actively responding and recovering from this one? So I want to provide a few summary highlights of the youth consultation report that I prepared in advance of the 73rd WHA back in May. And I think some of these points hopefully will be helpful to you in terms of some of the thoughts that you might have already been having over these past couple of months. So the identified areas of priority in terms of, from a youth lens, that I echoed and advocated on directly to the office and made its way up to the Minister of Health's Patty Hajdu's briefing binder, were these areas of priority: individual well-being from the respect to individual identity, grief and belonging, prevention and preparedness. How do we invest in public health systems in an ongoing crisis, perhaps, and health outside of one, and sustainable development, including climate action and planetary health, as well as education and development. I think tackling disruptions to education and training, I think that's one of the very unique and direct impacts to people such as ourselves. So kind of elaborating a bit further on the individual well-being piece, these pieces kind of came out and I could talk for an hour on this entire slide in terms of all these different pieces, but I think just to cover them briefly, I think for me it was very important to ground not only how I was processing my emotions, and I continue to process my emotions and feelings about what's going on in the world, the challenges that come up, the issues that come up in the context of my own intersectional identity, and recognizing that each one of us has that unique lens in terms of how we're processing what's going on in the world. And part of that is how we're dealing with things, and how do we deal with grief of a very changed world, and a world that will continue to change so rapidly, and at the same time feel connected to our communities, feel a sense of belonging. And it sounds a bit contradictory because we're, initially the term social distancing was used, and not knowing what that actually could impact on in terms of cutting those social ties, knowing that those are some of the most important pieces of protecting people's health in terms of tackling loneliness, as it has been identified as a area for public health intervention. And obviously racism has an impact on not only individual well-being, but collective well-being of our communities, recognizing that we are seeing more prevalence, but also maybe more intolerance from a general population lens on racism against BIPOC folks, Black and Indigenous people of color, as well as East Asian racism in the context of the origins of the COVID-19 pandemic. And these are things that I think, I don't need to echo too much to this particular audience, but I think come into the context of individual well-being. And in terms of prevention and preparedness, I think thinking about how do we, once again, invest in public health systems, despite being in a crisis that is stretching our public health systems to its limits and perhaps beyond. Where we're seeing that some of the core functions of public health systems in this particular crisis in Canada being stretched to a point where we're calling in the Red Cross. We need more redeployments from other areas and sectors to assist with contact tracing, case management of people who have been diagnosed with COVID-19, including asking students, including asking other government workers to be redeployed from different sectors, including asking people who have retired to come back into the workforce to assist with those pieces. So it's been this, incredible paradox of balancing the prevention pieces. When we shift all these resources to public health, and when we're outside of a crisis, we're going to look back and see, like, why are there disproportionate resources to public health, perhaps, when everything is going well? So it's about how do we prioritize health and social equity with a health and all policies approach, outside of a crisis, outside of a pandemic. And sometimes it's easy to make systems changes because we have everyone on board, perhaps, in an acute crisis, but also making drastic changes to the systems that have worked in some ways is also really difficult in a crisis. One comment before I go on to the other two pieces is something that has been echoed by many experts, other member states around the world, around the importance of universal healthcare and resilient health systems as a key component to ensuring that we are able to get out of this in one piece. Interestingly, on the right-hand side, you'll see the respondents to that initial survey that I put out back in March and April of this year. Canadian youth identified the top areas from their perspective of focus at the World Health Assembly should be primary care and universal health coverage. So I think, we understand where investments need to go. We understand where discussions ought to happen. And so looking back, it was so interesting to see that this piece had been identified much earlier on by people such as yourselves. And on the left-hand side, I think it's something that's constantly on my mind in terms of how do we mitigate, how do we prevent all these other impacts of the COVID-19 pandemic, and these pieces of the impact on resource restriction, on urgent, non-COVID conditions, other healthcare conditions that require urgent care, but maybe are being delayed, or even chronic conditions, as many people suffer from, like diabetes and cancer, and the delay in care for those pieces. But even outside of the healthcare system, and something that's important to distinguish is, there's the healthcare system, and then there's the public health system, everything that, knowing that health care systems in terms of the clinic, the hospitals, only constitute and impact about 20% of our health and well-being. And all those other pieces outside of it, in terms of burnout, economic injury, mental illness, psychological trauma from the pandemic, and from the impacts of public health measures that sometimes can be quite limiting to being able to see family members, see friends, see our social networks. Those things are becoming more and more apparent in terms of how they will impact us in the long term. But I think we're also learning how to cope a bit more with those pieces. In terms of sustainable development, I think I've mentioned a few times around how do we leverage this opportunity to make climate change action really happen, and in the context of planetary health, knowing that we can't have a healthy community, healthy populations without a healthy planet. It's pieces of knowledge that has been a relatively new growing field of academic knowledge, but it's a piece of knowledge that other peoples, such as the stewards, original stewards of this land, certain First Nations, Métis, Inuit communities and populations across Canada have identified much earlier on in their worldviews that the connection to land, connection to each other is so important for a healthy community. And this One Health approach, in terms of the integration of the interactions between humans and animals and the spread of zoonotic disease is an area that is getting more and more conversation about as member states are demanding to know the original origins of the SARS-CoV-2 virus. And in all of this, how do we advocate for a just recovery, a just and green and equitable recovery from the pandemic that recognizes all these unique pieces that we're dealing with concurrently? And finally, I think this is probably, this might be top of mind as we're all learning together in a virtual format now. How do we tackle disruptions to education and training, this digitalization of the classroom? How do we get meaningful employment and volunteering opportunities? And how do we allow youth, students, and young professionals to be a part of that movement for community building, recognizing that not only do we all have really important things to share and bring to the table, but we are the generations of peoples that will be the future leaders, current leaders of the communities that we serve. And how can those governance structures, how can the pieces that allow for voices to be heard meaningfully, how can the governance pieces actually reflect that in a meaningful way? Some additional reflections, and I know we're running out of time, but I think I'm nearing the last few slides, and I do want to have enough time for a few questions and perhaps some discussion. But some of the things that I was very pleased to see in terms of some of the comments made from member states recently are around widespread health and well-being impacts of COVID-19. I think more and more member states, being countries around the world, are emphasizing the negative impacts of the COVID-19 pandemic on health in terms of all those other pieces that's not a direct impact from being infected with COVID-19 for example, such as like mental health, non-communicable diseases, palliative care, sexual and reproductive health, as well as thinking about how certain member states are disproportionately impacted by climate change, as well as those places with low resources, and how do they respond to things like natural disasters such as hurricanes that are exacerbated by the changing climate, and how do other nations that may not recognize some of the immediate impacts, because there's a great slide that I didn't include in this presentation on the changes to or impacts to human health from climate change in Canada, in terms of migration, in terms of infectious disease such as Lyme disease, in terms of wildfires affecting respiratory health, asthma, impacting ER wait times, emergency room wait times. So how do we build an economy of well-being that considers green policy and moves beyond emergency response and towards resiliency for future crises? One of the really important pieces is economic recovery and stimulus, a conversation that's happened quite a bit in Canada, something that I think other nations, as pointed out by an African region intervention, commenting on the need to support economic recovery in their nations. The other piece is, I think, important to realize and recognize the proportionality of public health measures. And some things, I feel like some of these points are being cyclical in terms of looping back to the impacts on youth in particular and students in terms of some of the disproportionate impacts and disruptions to other sectors such as education. And I think some jurisdictions in Canada, some jurisdictions around the world have closed down schools, and how do you balance that approach to limiting the impact of community spread of COVID-19, but also allowing for students to get that socialization, also recognizing that not every home is safe for young people, and also not every young person has a home. And health workers, I am so humbled to be here with you all and to be speaking about some of these things, and to have had these experiences over these past couple of months. They have been difficult in some ways, but overall, I've been telling friends and colleagues that I'm very humbled and grateful to be doing this work. You know, this year, 2020, is the International Year of Nurses and Midwives. And how do we truly honor them in the work that they do currently, presently, in the past, now moving into the future. And there was a comment that next year, 2021, should be named the International Year of the Health Workforce to celebrate health workers. And it brings it to, also important reflections that essential workers, for those of us in Ontario, mentioned a couple months ago, were defined as, people that assist with, like, sanitation engineers that help us assist with the ongoing core pieces of society that we know are so important, but are unrecognized sometimes outside of a crisis, or grocery store workers that allow for all of us to get the food that we need to put on our tables. So all those pieces also come into reflection when we think about some of the core functions and essential functions of our society. I've just been really grateful to be able to share some of my perspectives as they continue to evolve. So look out for them, or I'd love to connect with you further to learn your perspectives and your priorities. This is something that I think a lot about, because being the youth delegate this year, youth often identify issues with unparalleled passion, understanding, and virtue, when others turn a blind eye or are complacent to the status quo. I really like this quote that I found at the Museum for Human Rights in Winnipeg. As Pearl S. Buck once shared, "The young do not know enough to be prudent, and therefore they attempt the impossible and achieve it generation after generation." So I hope that some of these words ring true, but more importantly, they inspire you to continue to do the really important work that you do with your colleagues, with your friends, with your networks, to be able to see the change that we want in the world, as I know this group really does. So as I mentioned earlier briefly, that the youth delegate role and these past few months have given me a unique opportunity to deep dive into the international development relations sector, the global health governance and diplomacy arena. And it's an area that I certainly haven't had a lot of experience in the past, recognizing that I commented that I come from a clinical training background. I come from a background of public health training, but from a kind of practice perspective and less from a policy perspective. I hope I've been able to elucidate a little bit about the context in which this presentation comes from, and some of these reflections are coming from as well. Lastly, I wanted to share a note on kindness and our shared humanity. I think it's so important that this left picture here, it's dated March 13th, 2020, which feels like so long ago, but this was at the height of when Italy's pandemic response was terrifying, when their hospitals were overflowing, and so unfortunately many deaths also took place because of COVID-19. And my dad sent me this photo because a close friend of his lives in Italy, and this was a note from a stranger, a neighbor, to my dad's friend, and it kind of goes to show the importance of reaching out to one another, and we are a collective, species, and to recognize our common humanity and looking out for one another, and being global citizens when there's a crisis, but being global citizens all the time, and recognizing that we have to look out for one another in times of crises and outside of those. I've learned so much from many different people. I would have to say one of the biggest lessons that I learned and continue to learn are from people such as Molly Penny here on the right, who's the in-house clown at the Children's Hospital in Ottawa. As much as I learned from Molly Penny, the clown, I also learned probably equally, if not more, from children that know how to play, know how to look after one another, know how to be very wide-eyed in the world that they want to see around them. And I hope that those pieces you also carry forward in your journeys as you are professionals, become professionals, and remember to be kind to one another. I have to say, a couple days ago, I was able to listen once again to Dr. Courtney Howard speak. She's an emergency doctor in Yellowknife in the Northwest Territories. And recently, over these past couple of months, she was running for the Green Party leadership. Unfortunately, she was unsuccessful, but she did come in a very well-respected third place. And having known that she was advancing planetary health while being, all the other hats that she wears, having 2 children, having clinical duties, but advancing planetary health for the betterment of our communities and health and well-being of our communities, I think meant so much to me in terms of knowing that there are other people that are moving these things forward. The other thing that she has taught me and taught many others on is there's a giant opportunity cost to imposter syndrome. I was just talking to a couple of other students the other night, and the pieces around, I'm only 4 months into my residency training here in Ottawa, and I feel imposter syndrome every day. So it's about leaning on that uncertainty, moving forward, but also not letting it take control, so that we silence our own voices before we're able to share them. Last note here, in terms of doing the really important work that we do, look out to assemble your team. I found so much energy and work and passion from a group of medical students through the health advocacy file. I want to special shout out to Michelle Quay here on the left here, who is a newly minted public health physician, resident physician as well. And here we are at a residency interview in sick kids, as we were both applying for pediatrics as well. But she was the one, after a long board meeting with the Canadian Federation of Medical Students, convinced me to apply again for this particular role. And here I am standing before you, sharing some reflections from that role. So I want to thank her for her persistent nudging. So once again, I would love to hear your thoughts through this survey, through reading the chat, and if you're able to make it, to email me about these roundtable sessions that are taking place this evening and tomorrow. So thank you so much for the presentation, for listening to my presentation. That's my email, that's my Twitter, as well as additional reflections on my journal. My apologies for taking up basically the entire time. Do we have any possible time for any discussion or questions?
We could pick 1 or 2 questions, but I believe the next session starts in 5 minutes. So we have to be mindful of that.
Okay.
Yipeng, would you like me to pick a question and, read it out? Do you think
Sure.
that would? Okay, great. So I've been reading all the wonderful questions that you have sent. And what I think I'm going to do is we might not get to address all of them. So I'm going to post them in our Facebook group. And then Yipeng, you can perhaps jump in and answer them over there as well. So for now, let's chat about this. With so many important global and public health issues, how do you decide what to focus on? It feels very overwhelming at times.
Yeah, that's a really great question, and it certainly does feel overwhelming at times, even in the best of times. I think the answer to that question is actually quite simple for me. I take a lot of advice from people such as yourselves through this survey that I put out, through these roundtable sessions that will take place. I would love to get into a further conversation around how do we strategize around where do we focus our priorities. Sometimes I think thinking about what's been helpful for me in terms of being a leader in different spaces is thinking about what table or meeting or space am I entering? What role am I taking on in that space? And maybe what are some of the things that have been discussed at that table, and what are some of the things that haven't? And thinking about where can we have the most impact, I think, is whether about how do we be the best advocate for a certain issue moving forward. And if that means we need to step aside and let someone else talk about that issue, or we need to partner with someone and be an ally on that issue, or we need to be out of that conversation entirely because it's not an issue necessarily for us to touch. So I think having that particular framework might help in terms of from whatever position, role, or lens we're taking, recognizing how best to move forward a particular issue, I think takes a bit of taking a step back to think about, are there certain issues that are not being mentioned because certain communities or populations are being silenced, or things are being disproportionately impacted on certain communities in an inequitable way. So I think having that equity lens, as many of you probably do, being in the realm of global health, I think is just so important and really helpful, perhaps, to be able to narrow down what do we do in the short term in terms of using our voice. Hopefully that helps.
Great. Thanks for sharing that, Yipeng. I'm just going to pick one other question because I see a couple of people have asked this. So essentially, what can young people who are just starting out their careers do to get involved with global health? What are some of the opportunities that you came across and perhaps you would encourage others to look into as well?
Yeah, that's a really great question. I think when I was earlier on in my journey, and I still feel super early on in my journey, believe me, I think is coming to spaces like this. I actually see Donald Sutherland here on the side, Dr. Donald Sutherland here, who I met, and I've said this a few times, but at my first conference with GHSYPS, when it took place in person, I actually forget where it was because it's taken place at a few different locations in Vancouver and Ottawa, and I think in Toronto as well. But in my first interaction with GHSYPS, Donald had sat down next to me and asked me about a health economics project that I was working on that was my second year of undergraduate studies in Hamilton. And that point forwards, he provided some feedback on that project. I forget where that project ended up going, but we stayed in touch, as did other people that I met in this space. And through GHSYPS, through the Canadian Society for International Health, through the Canadian Coalition for Global Health Research, these are all really great means in terms of convening with other like-minded professionals and youth and students to be able to build those networks to get more and more involved and think about where best you might fit in terms of the work that you want to do, and finding the right tools and skills to be able to do those things. So hopefully that's helpful for you.
Thanks, Yipeng. So I want to be cognizant of the time. We are running out of time, but as I said, I took notes of all the questions that you have shared, and I'm going to share that with our speaker at the end of this session. Please join our Facebook group where you can continue the conversation, and if there are any other thing that pops up later, you can connect with your peers as well as everyone attending this session. So thank you again, Yipeng, for hosting such an engaging session and sharing your insights. So with that in mind, we're going to wrap it up here and give everyone some time to hop on to the next session. Thank you.
Thanks so much for being here, everyone.